Hi everyone, my name is Amy, and I chose to take this course because I'm also in the trauma certificate program, and we were required to take two additional. Um, our electives were required to be focused on um, specific populations vulnerable to trauma. Um, I also chose children and families at risk because in my previous internship and my current site, I've worked with children who have experienced largely complex trauma, and I wanted to have the best knowledge that I could um, in working with these families. Um, what I hope to learn from this course specifically is on certain topics that I haven't been exposed to, like adoption, foster care. I have been exposed to some grief and children, and I'd really like to learn more about working with them. Um, I also find it difficult at times to work with families, and um, so I think this course will help me. I think some of the difficulty may come from just not having a full understanding of an at-risk population and exactly what they're going through. And I think this course will provide a lot of insight into that. That's useful, evidence-based, something to really enhance my professional skill set at graduation. Um, I really enjoy at risk populations. I find the work tremendously rewarding and interesting. I love the people. I've learned so much about myself working with at risk populations. And I guess in terms of children and my feelings about child abuse, I think children are probably our most vulnerable um, population, followed by aging adults. Children really need a good, strong adult advocate, and as a social worker, advocacy is a huge part of my identity and my role in working with children. And they need us. They need strong advocates to help them through difficult times. If I think about a child that is in foster care or has lost a parent and and is really feeling abandoned, lost, um, confused, and the whole family is affected. I think having a solid adult um, to provide a really good holding environment for what the children are going through is really important. In my current field experience, I have had the opportunity to work with some perpetrators of certain abusive behaviors, and that was eye-opening for me. I remember back to one of our courses where we were given a sheet and we were asked to check off what populations we would find an aversion to working with. And I really felt at the time that I felt bad. I felt guilty for checking off certain populations that I felt I couldn't work with. But I do know, because my own personal experience also feeds my professional lens and my identity as an individual and then a social worker, that there are certain populations that I know that I would not be able to serve, because it wouldn't be the best for them and it wouldn't be the best for me. And one of those is perpetrator of child abuse. I just I just find it I just don't feel good when I think about people hurting children, and I find it really difficult, I think, to be to explain it maybe a little more accurately, I find it very difficult to understand how someone could harm a child. I understand logically. I understand from my head completely understands it, but my heart does not. And if I have that disconnect in a session with a client, then I know that I'm not serving them well. So perpetrators of child sex abuse is a population that I would not be able to work with. And I think neglect is a different type of abuse, less severe. To an extent, I think that's really unfair, actually, to say that it's less severe. But again, my personal experience feeds my professional perspective. So if I'm being truly honest, then I can't serve that population. But I believe this course can help in shedding light on that, how to serve a family that is in this type of situation, and also how to, it's just an opportunity to work with bias. And I welcome that. I feel like I've grown tremendously in my field experience. I've grown tremendously throughout this program, and my mind continues to be open. And I work to be a compassionate social worker to all human beings, just recognizing the dignity in each human being. But that doesn't mean that I can work with all human beings. So I'm really looking forward to how I'll feel after this class, and also what information I can use that we learn week to week with some of the families that I'm working with in my field experience. I'm in an outpatient psychiatry clinic at a major medical institution in a really impoverished area of Philadelphia. And I know undoubtedly I'm going to learn tremendously helpful, useful information through this course. I look forward to learning along with everyone and hearing everyone's experiences. And I am super excited that this is the last class and then we graduate. It's really exciting. So look forward to the next 7 weeks together.